Eye infections, causes and treatment. There are many eye infections including conjunctivitis, keratitis and cellulitis. Symptoms can include itchiness, discharge, vision changes and more. While many minor eye infections heal well on their own, others can be serious and may cause permanent vision loss. It is important to contact a health professional if a person has changes in their eyes or vision that could indicate an infection. This video looks at the different potential eye infections and how to treat them. Conjunctivitis, often called pink eye. This is the most common eye infection. The conjunctiva is a thin layer of tissue that covers the whites of the eyes and insides of the eyelids. Conjunctivitis is an infection or inflammation of the conjunctiva. A person may get the infection in one eye or both. Types of conjunctivitis include viral, affects adults more than children and is the most common type of conjunctivitis. Bacterial, a pink eye that commonly affects children. Gonococcal, common in newborns and sexually active teenagers. Chlamydial, typically occurs alongside a genital infection. Allergic, occurs when allergens enter the eye such as pollen, dust mites or pet dander. Irritation from getting a chemical or foreign object in the eye can also cause conjunctivitis. A person may have excessive eye watering or discharge from the eye if this happens. No matter what the cause of pink eye, telltale symptoms include discharge from the eye, eyelids that are crusted together upon waking up, whites of the eyes that look pink or red, itchiness in one or both eyes, feeling like there is sand or grit in the eye, excessive tears. Diagnosis and treatment. A healthcare professional can often recognize conjunctivitis by examining the eye and discussing the person's symptoms. Many people can treat viral conjunctivitis at home. Medical treatments for pink eye by type include viral, cold compresses, topical antihistamines, or artificial tears to soothe the eye. A doctor may prescribe antivirals if the cause is the herpes simplex virus or HSV or the zoster virus. Bacterial, if the eyes do not improve after 5 days or 24 hours of treatment, a person should see an ophthalmologist or optometrist immediately. Mild bacterial conjunctivitis may resolve by itself after 2 weeks. Gonococcal, artificial tears and prescription antibiotics are common treatments for this type of conjunctivitis. It is common in neonatal infants, and many hospitals have preventive protocols to limit occurrence. Chlamydial conjunctivitis is again common in neonatal infants. Treatment often requires assistance from multiple specialist providers and oral antibiotics. Allergic, avoiding allergy triggers or saline eye drops, allergy medications or allergy shots. A person should avoid touching their eye and should wash their hands frequently to avoid spreading conjunctivitis to others. It is wise to contact a pediatrician if an infant has signs of conjunctivitis. Keratitis. Keratitis is inflammation or infection of the cornea, which is the clear outer layer on the colored part of the eye. The Centers for Disease Control and Prevention states that improper contact lenses care increases the risk of keratitis. Wearing lenses for too long or not cleaning and storing them correctly can increase the chance of germs getting into the cornea. Without treatment, keratitis can cause scarring on the cornea and permanent loss of vision. The different types of keratitis include herpes keratitis. This condition happens when the herpes simplex virus infects the cornea. Bacterial keratitis. Improper care of contact lenses can cause bacterial keratitis, but it can also happen from the eye injuries, a weakened immune system, and certain eye diseases. Parasitic keratitis. A tiny amoeba called acanthamoeba amoeba can cause this keratitis, which is also called amoebic keratitis. It is a rare type of keratitis. It is often due to exposure to contaminated water when bathing, swimming, or changing contact lenses. Fungal keratitis. Several types of fungi can enter the cornea and cause fungal keratitis. This is more likely to happen if a person has a weakened immune system, an eye injury, eye disease, or uses contact lenses. Symptoms of keratitis include redness and irritation of the eyes, pain in the eyes, a feeling of something in the eye, sensitivity to light, blurry vision, discharge or watery eyes. Diagnosis and treatment. A doctor may need to use a special light to view the eye or send a sample of cells to a lab for testing to determine which type of keratitis a person is experiencing. They will also take a careful history to assess possible risk factor exposure. Keratitis treatment may require antibiotic, antiviral, or antifungal medicine in the form of eye drops or pills. Endophthalmitis. Endophthalmitis is an infection of the fluid or tissue inside the eye. It requires immediate medical treatment or it may cause blindness. According to 2018 research, worldwide cataract surgery is the most common cause of this condition. Two common types of endophthalmitis include exogenous endophthalmitis. This most common type can occur after an eye injury, surgery, or injection, when the eye's protective surface is compromised. Bacteria or fungi enter the eye. Endogenous endophthalmitis. This infection stems from an infection in another body part that spreads to the eye. For example, it can happen with a urinary tract infection or blood infection. Symptoms of endophthalmitis include eye pain, redness, changes in vision, sensitivity to light. Diagnosis and treatment. The American Society of Retina Specialists says that most causes of endophthalmitis require antibiotic or antifungal injections and possibly emergency surgery. Cellulitis. Cellulitis is a bacterial or fungal infection. It can affect the skin and the eyes. Two types of cellulitis may affect the eyes. Preseptal cellulitis. This type affects the eyelids. Orbital cellulitis. This type affects the eyeball. And soft tissues behind the eyelid septum. Symptoms of cellulitis in the eye include bulging of the eye, red eyelids, swelling around the eye, vision changes such as double vision or blurriness, trouble moving the eye normally, fever, fatigue. Diagnosis and treatment. Doctors often diagnose preseptal cellulitis with clinical observation. If a doctor suspects orbital cellulitis, they may order certain scans or blood tests. They may also take a small sample of cells from the eyes or nose. Cellulitis requires antibiotic treatment. Sometimes a person needs antibiotics given in the hospital. More severe cases may require surgery to drain fluid from the infection. Stye. A stye is an infection in the eyelid, usually in an eyelash follicle or one of the oil glands of the eyelid. Bacteria can cause a stye that may occur if a person touches their eye with unwashed hands or after touching their nose. A stye may appear on the eyelash line or just inside the edge of the eyelid. Symptoms include a red, painful lump, a bump that looks like a pimple or boil, soreness or scratchiness on the eyelid or eyelash area. Diagnosis and treatment. Most styes will clear on their own with home care. A person can use a warm compress for 15 minutes 4 times a day. They can also gently massage the nodule. Blefaritis. Blefaritis is inflammation of the eyelids. Causes include bacterial infection, allergies, clogged oil glands in the eyelids, and certain skin conditions. There are two main types of blefaritis. Anterior blefaritis, this affects the eyelash area, and dandruff or bacteria can be the cause. Posterior blefaritis, this affects the inner eyelid. Problems with the oil glands in the eyelids can cause this type. Other causes include acne, rosacea, and seborrheic dermatitis. Symptoms of blefaritis are redness and swelling of the eyelids, itchiness in the eyelid, watery eyes, burning or stinging in the eyes, feeling of an object or grit in the eye, eyelids that appear greasy, flaky skin around the eyes, crusty eyelashes or lashes sticking together, sensitivity to light. Diagnosis and treatment. A doctor may diagnose blefaritis through an eye exam and discussion of symptoms. Blefaritis symptoms respond to home care. Regular cleaning of the eyelids and eyelashes with water and baby shampoo is helpful. If a person has dandruff or rosacea, they can talk to a doctor about effective treatment for these conditions to help keep blefaritis under control. Severe cases of blefaritis may require antibiotics or steroids. Uveitis. Uveitis is inflammation of the uvea, which is the middle layer of the eyeball that contains the iris. Doctors associate uveitis with certain health conditions including herpes zoster infection, psoriasis, rheumatoid arthritis, and inflammation that affects the joints, syphilis, AIDS, ankylosing spondylitis, which is inflammation affecting the spine, multiple sclerosis, an autoimmune condition where the body attacks the nerves, tuberculosis, a bacterial disease that affects the lungs, ulcerative colitis, an inflammatory condition affecting the digestive tract. Symptoms of uveitis include redness in one or both eyes, sensitivity to light, eye pain, blurry vision, a sudden appearance of particles or floaters in vision. Diagnosis and treatment. Doctors diagnose uveitis with an eye exam. However, they may also take a person's health history and order blood and imaging tests such as an MRI to check for associated conditions. Treatment may include steroids in the form of pills, eye drops or injections. This will depend on the cause of uveitis. When to see a doctor? Some eye infections such as an stye or Blefaritis respond well to home care. However, other eye infections such as Endothelitis are serious and can potentially lead to a permanent loss of vision. If a person has signs of an eye infection, they should contact a doctor. Severe symptoms such as an extreme pain or a sudden loss of vision require emergency medical care. Likewise, if symptoms of a stye, Blefaritis or conjunctivitis fail to improve with home care, people should see a doctor.